Yeah, it's live streaming now.
I'm going to figure out why is it echoing.
So I can't hear it on my end. You can maybe on your end. I can't. For me, it's fine.
Let this go. Why is echoing? Okay.
Yeah, let's do the interview, then just upload later on.
Okay. Okay. I know everybody's gonna be like, what is happening? They were supposed to go live at 7 a.m. and 11 p.m. What is the holdup? They're like almost 20 minutes late. And that's usually
you know that we are actually live right now on YouTube. Let me find you on YouTube.
And I'm not echoing. Do you hear echo?
No, I can't. You're perfect on my end. Let me find you on, let me just see if we are live on your, so SWGA. I don't know why you can't. I can see that on the screen it says we are live, and if people are watching, forgive us. Yes, so what's your Facebook page? It's just SWAG, right?
SWGA.
Oh, SWGA, sorry, SWGA. And then it's a patient advocate, right?
Yes.
I just want to figure out what's happening. Yes, it says we we are live right now. So what's happening? Tell me what's happening on your end, because I can see us live right now.
It's showing us live on my end. I'm looking at it from my phone. I'm on my computer and I'm looking I'm looking at it on my phone. So we are live.
Yeah. So what are you, is there an echo on your end?
I don't hear any echoing anymore. But then I remember before I start YouTube, I'm supposed to mute YouTube. I muted on my end, but everybody else can hear the conversation. So now people can hear us telling all of our mistakes. Y'all forgive us for these technical difficulties.
I know.
And it showed I went live, like this is my third time going live.
I actually wanted us to take us live on Facebook using my phone, but it's not working. All right, let's do this.
And I know we were trying to go live on LinkedIn too, but.
Oh yeah, LinkedIn, I'm still fighting with LinkedIn. I'm still fighting with LinkedIn because I don't know what happened. Yeah. So, yeah, we can do this. I am live on my, I'm live on my Facebook page just for a few seconds, and we are live on your YouTube, right?
Yes. We are live on SWGA Sickle Cell Awareness YouTube channel.
I'm here, Monica.
Okay, we ready for our interview?
I'm so ready. I've been waiting for this. I even slept for an hour just to be ready for you. It's past 11 p.m. here. It's almost Saturday.
Oh, wow. And that's the thing. We got a lot of feedback on Facebook where people were responding and reacting to the interview. So I'm super excited. I thought about it all day yesterday and today of how this interview is what was going to go and the structure of it. And the first thing we're going to do is introduce ourselves. I do apologize to everyone for the lateness. I know we were supposed to get started at 7 a.m. due to technical difficulties, but we are here. We are live. We are getting started, and we're going to talk about the power of collaboration because we are both global health advocates for sickle cell. My name is Monica Rockwell. I am the founder of SWGA Sickle Cell Awareness, And I advocate for myself first, as well as other patients living with sickle cell disease. And my guest today, I am so honored to have, and she is a registered nurse. So I have a registered nurse on my YouTube channel. Finally get to interview a nurse, and I'm going to let her introduce herself. Miss Agnes, go ahead and introduce yourself to the audience.
Well, thank you so much, Monica. I've also been waiting for this, and this is a long day for me. For those people that don't know how far apart we are, I'm in Melbourne, Australia, and it is, I think now, because we've been back and forth, we've taken maybe 20 minutes late. So it's past 11 p.m., almost midnight, going into Saturday. So I'm Agnes Nsofwa. I'm in Melbourne, as I said, Australia. I'm a mom, first of all. That's my first job. I'm a mom of 4 beautiful humans. And I do so many things, but some things that stand out for me, I'm a registered nurse. I became a registered nurse because of my daughter, who was born with sickle cell anemia 13 years ago. And because of that, I started advocating for her. So you advocate for yourself as a sickle cell warrior. I started advocating for her first before I went on and advocate for others. So I'm a sickle cell advocate, and I'm a registered nurse, and I'm a mom. Those are the most things that stand out.
Yes.
Yeah.
Yes. And I know everybody in the audience want to know how we met. And people that know me and my audience that knows me, I'm always looking for all things sickle cell. And when I started my platform, my goal was to always connect with sickle cell warriors everywhere. And when I started researching sickle cell, especially the genotype beta thalassemia, a lot of places in India popped up on my social media and in my research, as well as Africa. UK was one of the biggest places I did a lot of research. And every September, well, actually I started in June all the way up to September, looking for different organizations that are international, that are global. And I did find Australian Sickle Cell Advocacy Virtual Conference. And that's how I was able to meet Agnes. And that was September the 17th through the 18th. That was a powerful conference. For those that missed it, that was a lot of resources, a lot of information, a lot of networking. And you were able to have discussion with other warriors, other caregivers, other medical professionals. And that was one of the greatest things. And I like how me and Agnes was able to chat through the Hoover app, exchange contact information. Then I found out she was a published author. So that was one of the greatest things about being online and being virtual. Well,
exactly.
This was your first virtual conference. So how was it for you?
Oh, I tell you, it was so incredible, Monica. I thought about the first time that I started an organization here. The first thing that I thought about was to bring people together. And I thought over the years, I'd attended so many conferences, some of them face-to-face, most of them virtual. I'm like, I think I can do this. You know, I looked at it, I don't think it's that hard. Maybe I can. And so we started planning 3 years ago, and then we're supposed to have it face-to-face last year. And then, you know, at the beginning of the pandemic, people thought, you know, it was just maybe one of those flus and it's going to go away. So we couldn't even think of coming virtual last year, because we thought, you know, it will go, next year will come face to face. And, you know, we postponed, we were supposed to have it last year in Sydney. We postponed, and then we went ahead and started planning for Adelaide in South Australia here. But as the month started going around March, I just thought, because we were supposed to have it, you know, in collaboration with the Blood Conference, which is held annually here by the Society of Hematology in Australia and New Zealand, because they helped us they supported us. Then I just told them that, no, I'm not seeing this is not happening. So we pulled out from that collaboration. I said, you know, if you are going to go ahead face to face, I don't think this is happening for us. Most of our you know, people in our group are just scared to move from state to state. And that time, Victoria, out of all Australia, Victoria was the worst hit with COVID in this country. And this is where my group is, that's the head office is based in Victoria. So we wanted people to travel from all states, then we go and meet in Adelaide, which is South Australia. But people are not ready to move. So we decided to, so around March, I just told our collaborators, I'm like, nah, this is not happening. We pulled out of that partnership. We said we are going to come virtual. So we started planning virtual. And a few weeks before, I'd attended the virtual conference, which was done on Hoover. I contacted Hoover. It was so easy. And then that's when I knew, that when I started thinking of who can I invite to speak, then I knew that I know so many people, I think over 300 people, and I put them on the spreadsheet. Like, now, out of these experts, out of these patients, who do I want to speak? I wanted to get at least one person from almost every country of all the countries that I had. And I ended up streaming down to about 90 speakers. And we said, you know what? It's a virtual conference. We've got 24, if we had to include with the time differences, like 48 hours in a day. So this is what we are going to do. We are going to have these experts speak here, these experts speak here. And then from 9 p.m., we had the community where we had now people from different countries. We had America, we had India, we had Bahrain, we had Mozambique, we had Malawi, we had Zambia, we had Tanzania, we had South Africa, we had India. Almost all the countries were represented. And then bang, I see Monica in there. I invited you to the conference because I remember, I invited. Yeah, before that, and then we started chatting. I'm like, oh, we need to catch up. We need to catch up. And so there started the friendship that, I feel like I've known you forever, and here we are. And last week we were on my platform, and I'm so glad I'm back here again. So that's how we met. But the conference was really life-changing for me, a huge accomplishment for me, and it was very successful. Out of all the speakers, I think only two people were unwell. Not that they didn't want to participate, only 2 people were unwell. And it was a very memorable experience for me. And we have most of the presentations also, they've been uploaded on our YouTube channel. So that, and now it's going to come annually. Again, we are back next year, depending on the setting. We may be in Sydney, face-to-face, hybrid in Sydney. Otherwise, maybe we'll come back to Hoover again. Yeah.
Oh, wow. Wow. Well, that's really good. For those of you who don't know what sickle cell disease is an inherited blood disorder. And when most people have healthy red blood cells, they're nice and round. But a patient that's living with sickle cell disease, they become crescent shaped, like my earrings.
Like your earrings. Yes, I love those earrings.
So they're crescent shaped, and oxygen is not getting all the way through the body. So that causes the cells to start sickling in that sickling shape. And it's interesting that a lot of people don't consider sickle cell a big thing, but there are over 300,000 patients that are living with sickle cell disease all around the world. And which segues into my next question and our next topic, which is global health advocacy. And when I started social media, it was interesting. The first people that started messaging me, DMing me, asking me questions, asking me about resources were people in other countries. It wasn't anybody in the United States. And so, which gave me an opportunity to continue to do more research. The first person reached me was out of Belize. And no, Brazil was my first contact. Jamaica was my next contact. India, because I have thalassemia, beta thalassemia. A lot of people.
Yeah, which is very common. It's very common there as well. Yeah.
Yes. So, and that's what made me start doing more research on what was available for patients with thalassemia, and that's what started the global work for me. And I started using the hashtag showing worldwide global advocacy. That's what SWGA stands for. That's what I always say. SWGA stands for showing worldwide global advocacy. And it also gave me an opportunity to start studying other languages. I know a little, I don't know a lot. I took Spanish in high school.
Oh my God. I just remembered, you know how we said you're supposed to do the homework? I didn't. I owe you.
I didn't either. We're going to come back again. We're going to come back again.
Yeah, we will come back again. Because we did set up a challenge that I should research the name of sickle cell in African countries. You are supposed to do Europe and Asia. right?
Yes.
Yeah, and I, oh
Yes.
my God, we forgot. No, we'll come back again. Or you can put them on the chat or somewhere under this video, because I'm live on my Facebook page. So under this video, we can.
And that was another thing I started. I'm a little rusty. I know my tutor is going to be kind of upset with me, but I started learning Arabic. I started learning that language because a lot of people that reached out to me were texting me or messaging me in Arabic or Farsi. So I was like, okay, I have to learn this language in order to better communicate with them. Or they're going to be like, Monica, do you speak this language? And the app that I use is the Google Translator. I like how it translates everything. And then I press the voice button and it tell me how to say it. It's like, let me say it this way. This is how to say this. And so I cheat a lot with that, because I remember going to a conference when people were there, the organization was trying to reach out to other people in other countries. I was like, well, how do you speak their language? I was like, I use Google Translator all the time. And now the phones can allow you to translate something. So if you're texting somebody and you want to translate it in their language, it'll translate it in that language for you. So technology is really good. And yes, and another conference I end up attending out of Europe is the Europe Sickle Cell Summit that was out of Europe. And that was a great conference during the month of September. I'm talking about sickle cell disease. And I ended up meeting,
I think we were just a week apart. So I think the consortium was first, then ours, then Europe Summit. So it was just like within the 3 weeks, all the conferences were done.
And that was the thing, that the biggest takeaway from all of this was all of the sickle cell organizations have the same needs. The people that are in Nigeria, they're looking to build clinics. I'm looking to build a clinic in my area because there's not a clinic in my area, a sickle cell facility. We have to travel to 3 hours to Atlanta or 4 hours to Augusta. And plus my sickle cell doctor, he is from Istanbul, Turkey. So he's Turkish and he knows a lot about sickle cell. That's what he specializes in. And another organization that helps, which I learned a lot from, is the World Health Organization. They have a great piece on sickle cell disease, how to treat sickle cell disease. And they're in a lot of underserved communities as well. So, it goes back to sickle cell is just not a Black disease. I know a lot of people think that, but it's dominated by the Black community. That's what people...
out of some of the things that I do, like I've authored a children's book, and then out of that children's book, I have created the character into a baby doll. So I put up, because it's done now, the people are making it, they sent me the pictures, I was excited, so I advertised it, and then somebody said, next time, make sure that you put the eyes that I relate with, like the eyes are blue. And it was, technically it was just something. It was actually somebody commented on the skin tone first, like she's not Black enough. So I was like, I didn't answer. I'm like, what does that mean? So I ignored that one. And then somebody said the eyes don't relate with Black people. So this is the myth. I mean, misconception we should break. For me, it was a deliberate move that the doll shouldn't look white, shouldn't look Black, shouldn't look Indian. I just wanted a funny character that depicts like a different part of everyone. And another one is coming. Actually, this one is another race altogether. But the current one is actually a bit of that. And her eyes are deliberately blue, because I know blue is not very common, blue eyes in African setting. But we do have Black people who have blue eyes. And so somebody wanted it to be Black, very Black, and the eyes. I'm like, oh God, it's not just about, sickle cell disease is not and this is what we Africans or Black people should help into breaking this myth that anyone can have sickle cell. Yes. It's a genetic condition. It's a human condition.
Yes. Yeah. Yes. And I found out later that there were some Asian people with sickle cell as well. I haven't learned to say it in their language.
Chinese people too. Certain part of China, they've also got sickle cell as well.
Yes, yes, and people take that lightly, and it's always interesting. For a minute, I thought that was just something that was in the U.S., where people only think that Black people had sickle cell disease. But going to a lot of virtual conferences and traveling virtually, you'll find out a lot of other people in other ethnicities or other backgrounds also had it. It becomes something that is something we talked about the last time, was it's something that's taboo, because sometimes people don't want to talk about sickle cell disease because of all the stigma that comes with sickle cell disease. There are patients that are always in pain, and my best friend sent me an article that I thought was interesting, and the article was saying that Blacks and African Americans can tolerate pain more than any other race. So that's one of the reasons why medical communities.
Yeah, there is. And your volume is again a bit echoey. Just look at your microphone. Yes, that is a misconception, because I remember Professor Wally Smith, when he did the presentation during my conference, he did say that. He did say that there's a study which showed, like, Africans do tolerate, but because of that, the medical professionals think we can't, I don't know, for whatever reason. And this is why there's so much talk in terms of negligence and pain management because of that. So yeah, if you listen to the presentation by Professor Wally Smith during our conference, it talks about the disparity of sickle cell in the Black community. So yeah.
He was one of the many speakers that I loved, and I remember asking the question, why can't medical professionals who are hematologists, why they don't treat sickle cell patients the way they do other hematology patients? And he was explaining
other cancer, simply just cancer patients. Cancer patients is the closest, because even when you, especially the pediatrics, let's not even say why don't they continue the treatment from the child, because there's so much care in children. And then when you're an adult, that care just drops down. So why can't they continue with the care that they provide to children, and it should continue on when they're adults? So, and then with just because even the children, like, they're all in the cancer ward, oncology ward most of the times. Sometimes some settings they have hematology and oncology, but the doctors are pretty much, most of them are the same. They're oncologists or hematologists. So they should continue on with that care that they provide to children, which should continue to the adults as well. Because most adults, especially the ones that have grown up in the same like hospitals and they just change, the change is so huge that some warriors would prefer to stay on and be on the pediatric if they had a chance forever, because the difference is just huge.
And that's another initiative that organization in Georgia is doing. They're creating an initiative to show patients how to transition from pediatric care into adult care, because a lot of time they get lost in the system, or they get lost in healthcare because they're no longer seeing their pediatric physician and they don't know how to get an adult physician. But then too, there are a lot of hematologists that just don't specialize in adult care. For sickle cell, there are a lot of hematologists, and a lot of hematologists that specialize in sickle cell. But I know in times past, most patients were given the diagnosis. They didn't live to be 6 or 8 or 18 years old or 21. I think the number they got stuck at for a while was they don't live past the age of 21. And I think that's why.
Let's talk about your diagnosis. So you were diagnosed around the 30s, right? So I want us to relieve that as well on your platform. I know you've shared this several times, because when was it 32, 35?
I was 38, almost 40.
Oh, 38. Oh my God. Yeah. When I thought it was 32. So yeah, you are a classic example how you were missing the system.
Yes.
And to be diagnosed that late, it's just crazy. Like, and last Friday I had Cynthia. Cynthia was 62 when it was picked up. 62.
Wow.
Yeah.
And to me, that is why I advocate so hard, because there are other people that are in their 30s, their 40s, their 60s, their 70s that have not been diagnosed, or they've been diagnosed late in life. And I think that's why they're starting to, they didn't do it in the past, but they're starting to do more research on adult care.
And now they're looking for patients to study to
better understand how adults are living with sickle cell in their older ages. And so now it's always good to see on social media where people are posting, I'm 42, I'm 50, I'm 60, I'm 70, I'm 80 with sickle cell disease. And there was a lady in Nigeria, she was 90 something living with sickle cell disease.
Those success stories. And do you know who originated that post? It was Cynthia. We saw it a few months ago, few not even months, maybe about 4 or 6 weeks ago. That was Cynthia. Just after her birthday, she posted in the group, sickle cell anemia disease group, and because she said, she's seen. It's very difficult to say, and you have to be careful when you say this. So many people are portraying like how. I thank God I've lived up to this age. So she said that one day I just felt, let me encourage these young adults and young people. I'm 60. I think when she posted, she was 65 or 67. So she posted in the sickle cell anemia group just to ask the warriors who are at a certain age, over 40, and they were posts. That's when I saw Cynthia. I'm like, I need to find this woman. They need to find this woman. So I found her. Then we spoke about it last Friday, that how she, all these people started. And then the young warriors now started posting how encouraged they were to see all these women, men who are in their 60s, in their 70s, in their 80s. It's just so encouraging. And I think it's about time that, slowly breaking that myth where people now are okay to speak about it. And people are having hope, to see that, people are living in their 40s, in their 50s. But at the same time, it's hard because, every day we are seeing that, a warrior is gone. Every day at least there's that. And then we need to look at also, it's still there, like in terms of disparities in some certain parts of the world where I'll tell you what, maybe 3 or 4 weeks ago, a sickle cell warrior in Zambia passed away, all because they couldn't find, she was anemic and they couldn't find blood for blood transfusion. That's what we hear. I'm not sure that it's correct, but that's what we are told, that it was because there was no one to donate blood in time. And so she passed away because of a lack of blood transfusion. So there's still issues here and there, but there is a bit of improvement coming to see where we've come from, at least for me, for the past 13 years when I came into the sickle cell space. So a bit of improvement.
Yes, and there are more treatment options. That's why I'm constantly telling my story. And I remember going to a few conferences locally as well as in other places, and they were like, well, Monica, you should go into the school system for children that have sickle cell disease so they can see that they can live as an adult with sickle cell disease. Continue to share your story. So I say, yes, I will continue to share my story because I want to give them hope. I want to give them hope, and I want to inspire them that you can live with sickle cell disease. I often talk about T-Boss, who's a celebrity with sickle cell disease. There are so many adults that are living with sickle cell disease, and they don't talk about it. But I'm glad that you're talking about it, and you're allowing us to share a different narrative of sickle cell disease. And there are a lot of stories that need to be told. And that's one of the things that I often say on my platform is, if you have a story, tell your story, because it not only helps you, it helps the people that are caring for you. It helps the medical
Exactly. And this is why you and I, with 33 others, we are coming up with this book, which will be published soon, as a way to contribute to telling the stories as well. And for me, I've just reached a point where I always emphasize that, look, I don't live with sickle cell disease. My daughter lived with sickle cell disease for 13 years. I thank God she had an opportunity to get a cure. And for me, my hope is to see that one day we don't even have to like, let's talk about it, because it will be just like any other condition where, you know, you are born with it and then you are cured. So my family has been given that opportunity, and the least that I can do when I started talking about this 13 years ago is to continue talking and talking and talking. And God has given me this platform, this initiative where I can ask anyone wherever they are in the world, and with technology now, you know, in America,
Yes.
in India, in you know, Saturday we were with Zachariah and them, even this one, was it last night, this morning, I can't remember, when I had a meeting in Amplify. This morning, my
Yes.
time
Yes.
was 6 o'clock. I remember
Yes.
today's Friday. Oh my God, today's Friday. So this morning, again, we had a meeting in our group. So we can still talk and we can still continue raising awareness, and it doesn't die, because every story is different. Even if it's the same story, you
Yes.
tell it differently, and there'll be a person who's never heard that story before, and they'll be like, oh my God, like my story, I've shared it so many times, my daughter's been cured, but always somebody will ask you like, oh really? Because we are a global of over how many billion people in this world, and you know, the more you talk about it, the more you tell the story, and people will still continue listening, and people, new people will still continue, and we just, you know, encourage people to talk their, tell your story.
And that's another thing that with the advocacy part of it that people don't see, or I don't think we talk about enough. There have been a lot of policy changes in government with sickle cell treatment. Now we are demanding them to make sure there are resources available for treatment and research on sickle cell disease. That's what the advocacy work. And I remember talking to some of the politicians in my community. It was like, oh, we need this, we need this. And one of the things that I love is the fact that I had to do a lot of talking to just get us telehealth, because we don't have a clinic. So we have a satellite clinic in order to still get help. And the clinic is not to treat the patient, but it's to help them manage it or get them stabilized. I know a lot of people think telehealth is replacing doctors, but it's not. It's to make sure that you are stabilized to get you wherever you need to go, to whatever medical facility that specializes in sickle cell disease. And Sanford Bishop, one of our politicians, Sanford Bishop, signed for us to have a grant to get telehealth for sickle cell patients. He's a big advocate on sickle cell, which is really good, because the more people we have in government to help us get these bills passed, the better. And there are people that are always in Congress, that there are people that are in certain sickle cell organizations. That's all they do is focus on the politics of sickle cell disease. What policies need to be changed, making sure that there are medical facilities, making sure there is health care for sickle cell patients. That is so important. And also making policies for these hospital and medical facilities on how to treat sickle cell patients. Because sometimes they'll run tests, and this is a challenge for sickle cell patients too. They'll run tests, your blood work is fine, your hemoglobin is fine, but you're still in a sickle cell crisis.
In pain. Yeah.
Yes.
And they'll think
like,
based on your lab results, you shouldn't be. Based on your lab results, they think you shouldn't be. So,
Yes, and it's like, so they're like, how are you in pain? It's like, I feel pain in my lower back. So the test results doesn't show any pain in my lower back, and it could be vaso-occlusive crisis. The pain could be anywhere. It could be in your arms. It could be in your leg. It could be in your back. I have pain in my legs. That's the worst place for me. And I know they run a lot of blood work, but I'm like, but my legs are still in pain, and my back is on fire. It's a throbbing. My legs are just throbbing. And they're like, but your lab works look really nice. And it's like, but are you not hearing me? And it's always funny.
Post that on social media, because they're leaving the emergency room, or they're leaving the hospital mad.
So fix your mic again.
They are treating the pain. It's like, but I'm still in the pain.
But your lab work says you're not.
Yeah, I know. It's crazy. There still need to be education. And this is why healthcare professionals too, they need to work in collaboration with sickle cell warriors and caregivers to just, you know, continue that partnership. So
yes. And one of the organizations, Nsofwa, is coming up with modules for nursing students. They're creating a module in the nursing book for them to, we have more than a sentence now. There's actually a chapter on how to treat sickle cell
More than a
patients.
sentence. I love that.
We are more than, because in the old medical books, we have just one sentence: sickle cell disease is, and that's it.
Yeah.
But it doesn't tell you how to treat a sickle cell patient.
But
And
no, the
another
sickle
thing
cell
that
textbook that came out this year, was it this year or last year? That book?
is
Yeah.
going to come out in 2022, April of 2022.
Yeah.
The
Yeah.
International Nurses Association and Professionals, they're coming out with that module, and because they're an association of nurses, sickle cell nurses. So they're coming out they're getting it into the medical community. So when you go to nursing school now, well, next year, that's going to be a part of your study.
Well, that's
Because
what
Dr.
we are
Vic,
doing for us as well. That's one of our objectives, is to actually be able to go into universities and colleges, because we have colleges here where you can do diplomas, like enrolled nursing is a diploma. You can do it at lower colleges, and then you go to universities. But also, as an organization, what we've done for us, we've created a course which came out 2 years ago, 2009. The moment we just got established, we created a sickle cell course, and it's on our website. So now we are applying with the Royal College of Nurses to have it accredited so that the nurses can actually do it. Right now we have it with another not-for-profit organization. It's for primary healthcare nurses. So if you're a member for that organization, you can do our course for free, but you also have it on our website. Our course is on our website. I've given it so many times for free, but we asked for a donation for $10 just to maintain it on our website. Now we are going to have it accredited with a Royal College of Nurses and the GPs next year, so that the doctors can also have it. And then we have like accredited points towards their CBD points once they do it. So that's what we are doing, but also trying to go into the universities. Just that this pandemic has so many things. You can't meet anyone, you can't do this. So the whole of last year, we just had to navigate and see how we are going to. We started with one university in 2019, and then we just, because as I said at the beginning, when the pandemic came, we thought it was just, it's just a flu, it's going to last 6 months. So everything was being pushed forward, like, no, maybe 6 months. Oh, no, maybe next year. And then, 2 years later, we are still in this stage. So once, hopefully now with the vaccines and life coming back slowly to normal, that's what we will try to do. But also in terms of treatment in Australia, you attended our conference, Federal Minister of Health. He spoke about pushing through the newborn screening, which we applied. We applied in 2020 November. We have it accepted with the federal government, the Department of Health. So it has 6 phases. We've gone through the first phase. We have 4 or 5 more phases, but you listened to the minister when you attended the conference. He assured us that we are going to have that, hopefully, fingers crossed, that we have that passed. So once we do, that's a major breakthrough for us, because if it was there 13 years ago, my daughter and some other children, the complications that they had, they wouldn't have, because it was going to be picked up at birth, because we don't have newborn screening for sickle cell disease in Australia. So that's some of the things that we are trying to do here.
And they're starting that back in the United States. I was wondering, because
In the 50s, they started it. And then after a certain period of time, they just stopped it.
Your mic again. You're sort of breaking up a bit. Okay.
Okay.
Yeah, because you started in the 80s. Yeah, you started a long time ago. There's huge difference. And again, we talk about the reason why it's like this is because of the migration patterns. Most of Australia, if you read the history, it has a colorful history with Black people in this country. But they started allowing like African countries to migrate to this country in the 70s, I think 70, 71. So you find that obviously, because sickle cell affects mostly people that come from different parts of the world, like Africa and the Mediterranean. I think these other places, again, they came maybe in the 60s or so. So it's a very young country in terms of migration. For people who have genetic condition, genetic, sickle cell. So you see that most of the treatment options, we do have people though who are like Greeks and them Italians in their 70s, but most of the Africans, we are all young in terms of migration. We came here in the 70s. So Australia has lived this, lot of years without having a lot of patients. And so in the past 10 years, the numbers just doubled. We are now in the thousands, and that's a lot for the clinicians. So they say it's rare, really rare, because even now it's very common to find a doctor who's just read it in the textbook once in their studies, then they actually see the patients. That's why during our conference, we had to make it a point that we partnered with all the clinicians in all the states. We have 5 major states where we have sickle cell in this country. So we partnered with all the major clinicians to be part of the conference, to tell their stories. And this is why I love stories. So we had videos of the healthcare professionals, just interviewed them, like, how it was when they started, the first sickle cell patient that they treated, and the numbers, and just how it has changed, and just how, right now, for example, I'll tell you, at the Royal Children's Hospital, they have about 50 patients. 10 years ago, there were like less than 10, 20 patients. Similar story in Sydney, New South Wales, Queensland, Brisbane, and then South Australia, Adelaide, so same. And so you find that it's changing, and that's why I think like newborn screening, you can only have some things like this if somebody has the initiative to apply for it. So no one has ever stood up to apply for newborn screening in this country. So when we inquired, they said that no one has applied. So the government can't do anything because no one applied. So now we had to come up with the initiative of going through the application process. And it just took a few months, and they said, okay, the first phase is gone through. So no, it's not there. They won't pick up, even though they test so many genetic conditions, but sickle cell disease is not one of them. Prenatal screening too is not for every hospital. It's not mandatory for every hospital. Even then, the hospitals that may have it, it depends on how learned the doctor is to remember that, maybe let's test, the hemoglobinopathy, because once the sickle cell is a specific test that they should do, it's not easily picked up if it's not requested in the blood test. So we are still far away, but I'm very, very optimistic. Like the things that we've done the past 3 years, I see us having a brighter future. I see us having the newborn screening. Just the bone marrow transplant started 2 years ago for sickle cell SS genotype. My daughter was the first patient. So far, we've had about 3 or 4, not so much, but it's a start that, at least now we can say on the world map that, Australia is having treatment for bone marrow transplant for sickle cell patients. I know we have, because when the adult hematologists, they just, because obviously with confidentiality issues, they spoke about one of the adults wanted to do it. We need to find out whether it's really happened and how that turned out in terms of success. But I know there's been a few children after my daughter done it that they're still happening. We're still lacking behind in terms of medication. We still rely on hydroxyurea. Advocacy has been approved, the first approval. It's in the country, but it's still very expensive for the patient. We still need to have it on the concession, as at the Department of Health sits every 6 months to plan which drugs are going to be at a cheaper concession price. So we missed out for the November agenda. We are missing out again in March. I've been informed that it's still again not on the March agenda. So I'm not sure what Novartis is thinking about when they are going to put it on that agenda so that it's debated whether it can be approved for a lower concession, which turns out to be about $6 for the 90 days script. But right now it's a bit expensive. It is here, but it's quite expensive for the ordinary patient. And then other drugs, not yet. We're still quite far. We don't have, even in diary, we don't have it. We don't even have it. Oxbryta, and in diary, we don't have it. So that's where we are in terms of, the treatment options. But also in terms of the other things that I can do in comparison with America, with our healthcare system, unfortunately, America is your healthcare system. Ours is better. And I did tell.
It is. I agree with you. I agree with you, because if you don't have any health insurance,
yeah. So when I came, I attended a conference with the Foundation of Sickle Cell Disease Research conference. I spoke about sickle cell disease from an advocacy point of view, and one of the things that I researched on was on our healthcare system, and I've done it in my nursing training. I did a comparison of the American healthcare system, the UK system, Australia, and some other European. I can say that, okay, UK is better than Australia, but we are far much better than America. So our healthcare system is free. So my daughter, the bone marrow transplant, I'm a taxpayer. So my daughter's treatment was free. And it's very easy. This is what I was even telling people like Professor Wally Smith and them when I attended that conference, that the way they do it is a taxpayer. So you say, get a certain income, you pay towards everyone from your taxes, you pay towards healthcare system. And then if you pay a certain amount, you pay excess, or you get healthcare, you get private health insurance. It's that easy. It's very, seriously, I'm not saying this is because I've read about it, but in hindsight, it's very easy. All we do is we pay. That's why every citizen in this country, permanent resident, and those on humanitarian visas, our healthcare system is free. But for concession medications like the one that I was telling you about, you need to qualify. You need to have a condition, obviously like a chronic condition, or you're in a lower income for you to get that less medication. Otherwise, things like surgery and them in a public system, you get it free. So America, get it together.
We are, and that was one of the things that they were talking about for a while. And it's a lot of people who just aren't able to afford their medicine. And that's why I partner with the Department of Public Health, Albany Area Primary Health Care, because there are grants out there and there is money out there for patients who can't afford their medicine. There are a lot of pharmaceutical foundations that will aid you in getting your medicine, or they'll give it to you free. It depends on your income. Low to no income will get you more than having a lot of income. We've discovered that recently in the last few years. People that are working, they tend to pay more for their medication than people that are not working or have low to no income. So there are systems in place to help those that don't know that there is help available. And that's my job. That's my responsibility, to make sure patients know that there are resources available for them, especially adult
I think
patients.
You should speak more. You should speak more, because some of the things that I see in the group, seriously, I think like it's what we see in the movies. Like in the movies, it's just in America, you don't have insurance, you won't be treated. Like, oh, is it really true? Is it really happening? Does it really happen that you go to hospital?
True.
So if there are those resources, please speak about them on Facebook, so that people that experience such situations know that they should. Because what you see in American movies and what I read in groups, I'm like, no, it actually does happen.
And I'm a person that has been in the medical system with insurance, and I've not had insurance when I got sick, really sick, and I couldn't work, and I didn't have any insurance. It's horrible. It is, but I've had help because of my social worker, and that's the key component to me. You're a social worker and your case manager. They'll help you get what you need, because they didn't want to treat me. That is that you have
insurance. I have a job. When I was working, I had insurance. I had great insurance. I had Blue Cross Blue Shield
health insurance. But when I get and every so often I would get sick before my diagnosis. I've always been in and out of the hospital. And that's what my cancer doctor said. He said, Monica, I just cannot believe that they didn't see you had sickle cell disease. All of the symptoms were there. I said, well, because he pulled all of my records when I was in Georgia, when I was in Alabama, when I was in different places. He pulled my medical records, but they were treating the symptoms. And at that time, I did have good health insurance, so they was just treating the symptoms. And then in 2010, that's when I had multi-organ failure. He said, Monica, I'm surprised they didn't pick it up then. And I was like, I don't know. And in Alabama, they have one of the best centers for sickle cell disease. They have the best clinic because they get a lot of funding for research for sickle cell disease. Dothan does, as well as Birmingham, Alabama. And so the resources are, and Tuskegee. Tuskegee is, they have a sickle cell organization there. They have a lot of resources, but Birmingham have more sickle cell organizations that can help sickle cell patients. So it's when you don't have insurance and you don't know you have a social worker. I do an event every year that's called Come Hub With Us. Come Hub With Us is a resource event for adult patients. I don't exclude pediatric patients. Pediatric patients are welcome, but my focus is adult patients. That's with the Come Hub With Us, you need to know who your care team is. Every sickle cell patient needs a primary care physician. And I know in other countries, they call them general practitioners. They need social workers, someone to help them navigate this system. They need a sickle cell specialist, somebody who knows what sickle cell disease and understand what sickle cell disease. They also need nurses. So when you're in a medical facility and you don't understand what the doctor is saying, or you need a healthcare plan, that's where your nurse come in and say, you need this, this, and this. You need this medicine. You need to take it this way. They'll tell your parents or your family, well, they'll tell my mom, Monica needs X, Y, and Z. Or they'll tell my friends she needs this and this, she needs this type of care. That's where the nurses come in and we come up with the plan for me to better manage my sickle cell disease. We also have insurance providers. One guy, he talked about how sickle cell patients can have Medicaid and Medicare insurance to help them get the care that they need. We have people that comes to this event that talk about healthcare insurance, as well as fitness. Eating is, which you just had last weekend. Nutrition plays an important part in your health.
It does. So and we are coming back with nutrition because Friday, Cynthia, sorry not to cut you short, Monica. Cynthia spoke a lot about nutrition as well. And I just, in my head, like I need to bring her back. So Cynthia, Frida, Kadi, and those that, KW, yourself, that spoke about the importance of nutrition. Ginger too. So we are coming back again to talk about nutrition because there's something about nutrition that, everyone has got a common denominator, like how they've stayed for years without having a crisis because of the nutrition. So there's something in the diet that really works for the sickle cell warriors. So that's important. So carry on. So nutritionists, part of your team as well. Psychologists, if you need to have a center for, excellence for sickle cell disease management, you need to have a psychologist as well. Yeah.
Yes, and you need to know who your caregiver is, because your family is not always your caregiver. Sometimes you have to hire a caregiver to help you manage your medicine. And when you're hospitalized or you're really bad off sick, they have to go to the pharmacy to get your medicine. They have to go and pick up your groceries. They have to give you everything you need, because sometimes when you're going through a bad crisis, you're in the bed for 2 or 3 days. I do have a behavioral health counselor part of the team, Travis Spencer, I don't know why I said Smith. Travis Spencer.
For sickle cell patient, he comes every year and do a breathing technique. Show you how to breathe when you're
mic again. I think your mic can feel when you're passionate about what you're saying and then it breaks off. Well, do you know that it's 10 past midnight for me?
Oh, I didn't know it was that late. It was we're going to conclude this on another day. And the next time that we bring you back, we got to talk about your book.
Because we didn't talk about the Amplify, which are part of the Amplify family as well. And that's a long story. We can't rush. All we can say is that Amplify Sickle Cell Voices is a global movement for people living with sickle cell disease and caregivers and healthcare providers who are willing to support, but mostly caregivers, sickle cell warriors, to give us a voice so that you can self-advocate. Better know how to advocate for yourself first before you can advocate for others. That's the main objective, purely that. And so we have people like you who know how to self-advocate, who are bringing this education to other sickle cell warriors and caregivers and advocates, so that we learn how to self-advocate before we can speak up for others. That's the main objective. And we do that by presenting education sessions virtually, face-to-face. And this next year, that's the way it's going to be. We'll be supporting warriors to have events in their home countries. We are going to bring a lot of hybrid events. The past 2 years, it's been all about virtual events. But next year, we are bringing a lot of hybrid events. We are encouraging people where COVID allowing, we will be supported. The members will be supported by the group. We have a brand new group, a new membership plan where we'll be supporting some good things to come. It's a long story. I can't speak much. And we have a chairperson who's Zachariah. Zachariah has got a vision which will present in time, but first he's presenting it in-house. Hopefully he presents in-house. He's already presented to the executive team. Now he needs to present to the members, hopefully on Sunday. And then we are coming on virtually after Christmas, where he's going to present his vision for Amplify. I'm there to support in terms of events, face-to-face, hybrid, mostly hybrid though, and virtual events. So look out. February, we are back with another, I think, 56 people, where it's a different setting to get all together, and I'm excited. So, but in detail, we have to bring Zachariah to come and talk about this in detail. But we have to come back. This level, we have to do part 4 now. So part 3 coming back on my platform. Part 3.
Yes. We're gonna have to come back and make sure, and we're gonna share this all over social media because our voices do matter. I like how Amplify said our voices do matter, and that is so important.
Your voice matters, Monica. And you know, you said, no, this is how we met. No, girl, I knew you way before you knew me. I'm like, I need to know this girl one day. And when we met finally at the conference, I was like, I know this girl because I'm sorry I call you girl. Forgive me. And I shared you with, remember last week? You're fine. Remember, was I telling you? Yes. I can't remember. I spoke about how I'm used to calling women girls. And it's not that I'm disrespecting you because, you know, there's obviously because of how sickle cell affects your sickle cell warriors. Some sickle cell warriors look younger than their normal age. So somebody might be in their 20s, but they look like an 18 or 16-year-old. So I did make a mistake one time. This warrior, that's how she's affected. That sickle cell disease has just made her to look a bit younger. So the way I'm calling you, I was calling her the same thing. I'm like, girl, oh my God. That person was upset. So I'm not disrespecting when I'm saying girl. So I made sure I saw you. First we connected on LinkedIn, and then I just kept seeing you. Like you are very popular in terms of the education, and the way why yours is very different is because you are actually living with sickle cell and you are talking about it. So you know exactly what you are talking about because you are walking the walk. So I knew you way before. So when we connected finally on LinkedIn, I'm just like, well, the opportunity has brought its, on Uber app, the opportunity has brought itself now where we can actually talk. But I knew you, I'm just like, oh, she's doing a good job. She is. And I was going to connect with you to come on my platform. So you are doing a good job. And this is what we want. So teaching Amplify is about teaching sickle cell warriors and caregivers to self-advocate. Then now they can go because they'll be answering the doctors. This is what I need, tick. This is what I need, tick, 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 tick. And not just go and form an organization without knowing exactly what you need to fight for. So it's a fight for life for you guys. And, I'm just glad that God gave me this opportunity to support you. And I'll do it for as long as I live. So, yeah, thank you.
And I will support you.
Oh, thank you. Thank you so much.
I would definitely support you.
Well, I'm going to sleep because it's Saturday now.
Yes.
I'm
well, I want to say thank you again. Until next time. Yeah. You have a wonderful night.
You too. I will see you on Sunday, 2 p.m. your time, 6 o'clock. Yeah, 2 p.m. your time, 6 o'clock my time on Monday. So I'm looking forward to seeing you again.
Yes. I'll see you Sunday.
All right. Thank you, Monica. Thank you, YouTube family. Thank you, Facebook family. We shall see you for part 3. Watch this space.